Welcome to the deep dive. Today, we're tackling something that often feels pretty complex, navigating the Office of Workers' Compensation Programs, OWCP.
Specifically, we're zeroing in on changing your treating physician if you're a federal employee with a work injury.
Right. Our mission here is to really cut through the red tape and give you a clear roadmap. We've looked at the regs, guides, even some case decisions.
Yeah, the goal is to pull out the essential steps, things you absolutely need to know, whether you're the injured worker or the medical provider trying to help them.
Because it's about avoiding pitfalls, ensuring care continues without interruption, and, well, making sure it's all properly authorized.
Exactly. It sounds simple, maybe switching doctors,
Yeah.
but with OWCP, if you don't follow their specific rules,
Oh, yeah, it can lead to real headaches.
Yeah.
We're talking unpaid medical bills, gaps in your treatment, things you definitely want to avoid. So let's get into it.
okay.
Let's start with the patient's perspective. You're injured, you need to change doctors. What's the first thing to understand?
Well, the first thing is your initial choice. As a federal employee, you absolutely have the right to choose your first doctor for a work injury. That's fundamental.
Okay, your first choice. And what about referrals from that doctor?
That's a common point of confusion. If that initial doctor you chose refers you to a specialist, say an orthopedist for your back injury, you generally don't need separate OWCP approval for that specific referral.
Ah, okay, so that initial choice gives you some flexibility there.
It does. But here's the critical part. Pretty much any other situation where you want to change doctors, especially if it's your idea, not a direct referral from the current doc, you must get OWCP approval first.
Before you make the switch.
Absolutely. Before. And, very important, your boss, your agency, they cannot authorize this change. Only OWCP can.
Got it. Only OWCP. So say things aren't working out, or maybe you move. How do you actually request that change? Is there a form?
No special form, actually, which maybe adds to the confusion sometimes. It boils down to a clear process. Let's call it 5 steps. Step 1, write it down.
A written request.
Yes. A letter to OWCP. Address it to your claims examiner or the district office. You need to clearly state you're requesting authorization to change physicians.
And you have to explain why, right?
Definitely. You must give your reasons, and you also need to provide the full name, the specialty, and the complete address of the new doctor you want to see.
Okay, what are reasons OWCP usually accepts?
Well, they need to be sufficient, is the term they use. Common ones are moving far away, needing a specialist instead of your current GP. Maybe you have valid dissatisfaction with the care you're getting.
Not just, I don't like them.
Right, not just personal preference. It has
Yeah.
to be more substantial.
Hmm.
Or maybe your original doctor retired or moved or just isn't available anymore.
So, like, my orthopedic surgeon, Dr. Adams, is retiring June 30th, so I request to change to Dr. Jane Smith, orthopedic surgeon at 123 Main Street. Something like that.
Exactly like that. Clear, specific, gives a solid reason. That's step 1.
Okay, what's step 2?
Step 2 is helpful, though not strictly mandatory.
Hmm.
Include supporting documents if you have them.
Like?
Maybe you moved and you include proof of your new address. Or say you're having trouble finding a doctor nearby who takes OWCP. Maybe list the clinics you called.
That reasonable distance thing you mentioned, about 50 miles one way.
Yeah, roughly 100 miles round trip is their general guide. If you can show nobody closer takes OWCP, that strengthens your case for someone further away. Or maybe a note from your current doctor if they're the one suggesting the change or withdrawing care.
Just helps build the case. Makes sense. Step 3.
Submit the request. Get that letter and any documents to OWCP. Critically, do it in writing. Don't just call them.
How do you submit?
Best way is usually their online portal, eCom, or the C portal. You could upload it directly. Mail or fax works too, but might be slower. And always put your OWCP case number on everything.
Okay, case number, submit in writing. Step 4.
You wait. OWCP has to review your request. They look at your reasons, check if they're sufficient under the regulations. That's 20 CFR section 10.317 if you want the specific rule.
And they decide.
They do. They evaluate it. Things like moving far away or going from a GP to a needed specialist, those are usually approved pretty readily. Other reasons, they have some discretion.
Right. Which leads to step 5, the decision itself.
Exactly. You'll get a written decision. If it's approved, great. They notify you, usually the old doctor too. Then you can go ahead and schedule with a new physician.
Knowing OWCP will cover it.
Knowing OWCP will cover the authorized treatment, yes.
Yeah.
If it's denied, the letter should explain why. You might be able to fix the problem, maybe provide more info, or you have appeal rights.
But the absolute key takeaway here seems to be,
Do not start treatment with that new doctor until you have that written approval. Don't assume it's okay. Because if you do, and it wasn't approved,
you could be stuck paying the bill yourself.
you absolutely could. It's considered unauthorized treatment, a huge risk.
Okay, that's clear. And quickly, you mentioned referrals earlier. If my current doctor sends me to a specialist,
Generally, no separate OWCP permission needed for that specific referral for the accepted condition. That's usually handled smoothly. Emergencies are a bit different, very rare, but you'd still need to notify OWCP ASAP afterwards.
okay, so that's the process on paper. But things can go wrong, can't they? Let's talk about the pitfalls. What trips people up?
Oh, definitely. A big one is the reason for the change. OWCP really does have broad discretion here. If your reason seems like just personal preference,
I just like Dr. B better.
yeah, that probably won't fly. It needs to be more concrete, related to the medical necessity or logistics of your care. There was actually an Employees Compensation Appeals Board case, ECB, back in 2015.
Okay.
Someone wanted to switch to a doctor like 450 miles away, basically just because they preferred that doctor. ECB said, no, that's not a sufficient justification.
So the lesson is provide clear work-related or medical reasons. Quality of care issues, need for a specialist, relocation. Maybe the local docs don't take OWCP, current doc is unavailable.
Exactly. And back it up if you can. Evidence helps.
What about that distance issue again? The 100-mile round trip.
That's another common hurdle. If you propose a doctor way outside that radius, you need a very good reason why it's necessary. Maybe it's suits or specialists you can't find closer.
And travel costs for those long trips?
Need prior OWCP authorization. If it's over 100 miles round trip, or involves airfare or an overnight stay, you must get approval beforehand to be reimbursed for those travel expenses. Don't assume it's covered.
Okay. What else goes wrong?
Timing. This is huge. You need to time your request so you don't have gaps in your medical care. Ideally, keep seeing your current doctor until the new one is approved.
Because the new doctor might not even see you without the approval.
Precisely. Many providers won't start treating a federal comp patient without that OWCP authorization confirming the change. They need to know they'll get paid. So if you stop seeing Dr. A before Dr. B is approved, you could be left in limbo.
Makes sense. Any other pitfalls?
Documentation, just not giving OWCP enough information, especially the new doctor's details, full name, specialty, address. It has to be complete.
And the doctor has to be, well, the right kind of doctor for OWCP.
Yes, this trips people up too. OWCP has a specific definition of physician under the Federal Employees Compensation Act, FECA. It includes MDs, DOs, podiatrists, dentists, clinical psychologists, optometrists.
What about chiropractors?
Yes, chiropractors too, but only for manual treatment of spinal subluxation shown on an X-ray. Very limited scope.
And who's not included as a primary treater?
Physician assistants, PAs, nurse practitioners, NPs, physical therapists, PTs,
Hmm.
while they provide vital services, often under a physician's supervision, they can't be your designated attending physician on their own for OWCP purposes.
Good to know. What about the employer? Can they pressure you?
They shouldn't. The regulations are clear. Your agency cannot authorize a change, and they shouldn't interfere with your choice or your treatment relationship if you feel pressured.
Document it. Tell OWCP.
Absolutely. Document everything and let your claims examiner know. Your right to choose and change with approval is protected.
Okay, last pitfall area. Billing and authorizations.
Yeah, the administrative side. If the change isn't properly authorized in OWCP's system, bills from the new doctor can get denied flat out. Unauthorized treatment.
Ouch.
Even after approval, sometimes there's a lag in the system updating the official attending physician. This might mess with automatic approvals for things like PT or prescriptions for a bit.
So what should the new doctor do?
They should definitely reference the OWCP approval letter when they submit their first bill. And it's really good practice for them to send an initial narrative report to OWCP shortly after seeing you, outlining their findings and plan. It helps formalize things.
It really helps to understand how OWCP sees things from their side, too. Let's peek behind that curtain. How do they track providers? Is it just the clinic name?
No, not really. It's more specific. First off, every provider who wants to get paid by OWCP has to enroll using their form OWCP 10168.
Every single doctor.
Well, they can enroll individually, or a group practice can enroll. If it's a group, they list the individual doctors who work there as servicing providers. So a doctor in an enrolled group doesn't have to enroll separately, but they need to be listed under that group.
Okay, so OWCP is really tracking the individual doctor, right? By their name, their credentials.
Exactly. Dr. Jane Smith, MD. not just general hospital clinic. When OWCP authorizes treatment or requests reports, they're usually focused on that specific attending physician.
Even if the bill comes from the clinic.
Yes, because it's the individual doctor's National Provider Identifier, the NPI, and their OWCP Provider ID that links the service to an authorized person. Just working in an enrolled clinic doesn't automatically make a doctor authorized if they aren't properly credentialed or listed.
So if you switch doctors within the same clinic,
You still technically need to inform OWCP about the change in the attending physician. It's usually straightforward if it's within an enrolled group, but OWCP needs to know who is now responsible for your care.
and what if the doctor moves, but you stay with them? Say, Dr. Smith moves from Clinic A to Clinic B.
That's not considered a change of physician by you, the patient. But OWCP does need the doctor's updated practice information, new address, maybe new tax ID, and the doctor themselves needs to update their OWCP enrollment details.
It's all about keeping OWCP's records accurate for billing and authorization.
Precisely. It avoids a lot of downstream problems.
Okay, let's flip this one more time. What about the clinic's perspective? If you're a provider or run a clinic, how do you handle these OWCP patient transitions smoothly?
Rule number 1 for clinics. Make sure any doctor seeing OWCP patients is properly enrolled before they see the patient. If you're a group, make sure new docs are added as servicing providers.
And keep licenses current.
Absolutely critical. OWCP will cut off billing privileges for an expired license, even if the clinic's main enrollment is active. That causes chaos.
So a new OWCP patient walks in saying they switched doctors to you. What should the clinic do?
Verify the authorization. Ask the patient for a copy of the OWCP approval letter for the change. It's really wise not to start non-urgent treatment until you have confirmation. OWCP recognizes you as the new doctor.
Or treat them as private pay initially.
That's an option, with clear understanding from the patient. Clinics can actually help here too, maybe assist the patient in writing their request letter to OWCP, or provide a letter saying they're willing to take the patient on.
What about getting the patient's history?
Super important. Coordinate with the previous doctor to get the medical records and treatment plan. Then, the new provider needs to send that initial narrative report to OWCP promptly.
That report again seems key.
It really is. It establishes them in OWCP's eyes, outlines their plan, confirms they're treating the accepted conditions. It sets the stage.
Now, what if a doctor leaves your practice? What happens to their OWCP patients?
2 main scenarios. 1, another qualified enrolled doctor in the practice takes over. You just need to notify OWCP of the change in attending physician, usually okay if the first doc is unavailable.
And the second scenario?
The patient decides to follow the doctor to their new practice. In that case, the patient still needs OWCP approval for the change in location provider, and the doctor needs to update their enrollment for the new practice. Good communication with the patient is key here.
And billing. Potential headaches for the clinic.
Oh yeah, initial bills from the new doctor might get rejected if OWCP system isn't updated yet. Make sure you're using the correct enrolled provider ID.
What about pre-authorizations the old doctor had, like for surgery?
Good question. Those might need to be reissued or formally transferred to the new provider. Best bet is for the new clinic to contact OWCP, reference the prior authorization, and confirm it's valid for them. Same goes for prescriptions. The new doctor likely needs to issue new ones.
Wow, okay. Lots to manage on all sides. Let's boil this down to some best practices. For you, the injured worker, what are the absolute must-dos?
First, use that initial choice wisely. If you can find a doctor experienced with OWCP that can help and keep any paperwork your employer gives you, like that initial treatment authorization, the Form CA-16.
And then for changes.
Communicate everything in writing to OWCP. Keep copies. Use the online portal if you can. It's faster and trackable.
Be specific about reasons.
Absolutely. Give clear, detailed reasons why you need to change, backed up by facts or documents if possible. I moved 200 miles is better than I want a new doctor.
And the big one, wait for the green light.
Yes, don't jump the gun. Wait for that written approval before seeing the new doctor for treatment under your claim. Call OWCP to check status if needed, but don't assume.
Know your rights with your employer, too. They can't force a switch.
Correct. They can request a second opinion exam through OWCP, but that's different from changing your treating doctor. Document any pressure.
And keep everyone in the loop once approved.
Please do. Tell your old doctor, tell your new doctor, show them the letter, tell your agency coordinator. Smooth things out.
Okay, now for providers and clinics. Top tips.
Keep your OWCP enrollment absolutely current. Form OWCP 1168 done, NPI, tax ID, license info, address all up to date. avoids payment nightmares.
Understand who counts as a physician for OWCP.
Yes. Know that only MDs, DOs, etc. can be the primary treater whose reports carry the most weight. Notes from PAs or NPs get them countersigned by the supervising physician.
And don't treat without confirming authorization.
Please don't, unless you're willing to risk not getting paid. Verify that OWCP has approved the patient's transfer to you.
Help the patient navigate the process.
It's good practice. Educate them on needing the written request. Maybe offer to provide supporting info. It helps everyone.
Have a plan for when doctors leave the practice?
Definitely. Have a protocol for transitioning OWCT patients, notifying them and OWCP promptly about who's taking over care. Train new doctors on OWCP procedures early.
And use OWCP's resources.
Yes. They have provider helplines, portals. If you hit a snag with billing or authorization after a change, call them. Often it's an administrative fix.
So wrapping this all up, it sounds like successfully changing doctors under OWCP really comes down to, well, careful planning, very clear communication, and sticking closely to their rules.
It really does.
Yeah.
Following the procedures, like those in the regulations and the FECA manual, is key. It's like knowing the combination to unlock the next step in your care.
You know, thinking about this whole intricate process, it's more than just bureaucratic hoops, isn't it?
I think so. It really highlights this constant tension, this balance between a patient's desire for choice and autonomy, the government's need for administrative oversight, and the hard financial realities of managing a large-scale workers' compensation system.
It makes you wonder, what does this level of detailed control over something as personal as choosing your doctor tell us about how large healthcare systems, maybe even beyond OWCP, might have to operate to stay financially viable? How much oversight becomes necessary? It's something to think about.